Our outpatient services at Mercy take care of burns of all sizes and patients of all ages. We see the burn from the initial evaluation of the burn and initially attempt to determine the size of the burn and the depth of the burn.
So the Enchanted Forest is just that place that kids can get away from the medical side of things. So it's a place that they can just be a normal kid. And this is where a lot of our therapeutic activities take place. So if they need some time to express frustration or they need some time to express sadness or grief, then they can come here and do this in a safe space. So my job as a child life specialist is to focus on the emotional coping side of being in the hospital. So there's three main aspects to my job. One is therapeutic play, helping kids express emotions about being in the hospital, whether they're frustrated or angry or whatever it is. And then doing medical education and procedural support, so helping kids learn about the hospital and going with them to their procedures. And then I do family support, so we try to have that holistic view and we take care of everybody in the family.
Our burn unit is a 9-bed unit where we care for the sickest of burn patients. Here we take a multidisciplinary approach to patient care, and we round with a team daily to ensure the best care for the patient. That team includes physicians, nurses, respiratory therapists, physical and occupational therapists, and as well as pharmacists to care for the patient. This area is where the critically ill burn patient is kept, and we attend to their needs daily. We have a vast array of subspecialty care when needed that we're able to provide for the patient.
The role of the nurse in a burn unit is to be the frontline staff member that not only cares for the burns physically, but also their social and psychological care that might be needed. We assess their vital signs on a continuous basis. We assess their wound care daily, their burns. Also would change their dressings and kind of evaluate how the burns look.
This is one of the areas that we would care for a typical small outpatient burn. It's in this area here that we might see patients at any time of day or in the middle of the night with a smaller burn wound. We have a lot of different options to us at this time to care for small burns, and it's really one of the benefits of coming to a burn center to care for your burns. This is our hydrotherapy suite where we treat the burn wounds. This is really a critical part of caring for the burn patient. It's essential for the care of the burn patient and really happens on a daily basis for the largest of burn injury. It's in this area here where we care for the larger burn wounds. The critically ill patients come back here almost on a daily basis to care for their burns. In this day and age, this is what most people equate with hydrotherapy. We no longer submerge patients into a tank, but we care for the patients on a spray table such as this with hoses that come from the ceiling to cleanse the burn wound. Hydrotherapy is really the process of cleaning the wound and redressing the wound on a daily basis. So the patient's wounds, the old dressings are removed, the wounds are looked at daily, they're gently cleansed and then redressed after they're evaluated by a physician.